In medicine, just like in anything else, we all have biases, and surgeons want to cut, radiation oncologists want to irradiate, but it is important for patients and providers to recognize those biases and also know the options. I'm very excited here at the 29th Annual Perspectives in Urology Counterpoint meeting with Ron Petersen, who is one of the exhibitors at this meeting. He represents IsoRay, which has a couple of different interesting products, and I want to kind of bring this to the fore. Can you tell us, first of all, about these things down here?
Yes, these are basically titanium seeds, and what we represent is IsoRay Medical, which does a Cesium-131 isotope.
So before you go further, what is Cesium-131 and how is it used?
Yeah, Cesium-131 is one of the radioactive isotopes that is used for prostate brachytherapy. There's basically 3 isotopes on the market, palladium, iodine, and Cesium-131. They will all work fairly well in treating prostate cancer. The one advantage that Cesium-131 has for the patients, by the way, is it has equivalent outcomes, but basically the side effect profile looks so much better, and that's been published in peer-reviewed clinical data, and showing that patients' recovery from their symptoms, or urinary symptoms, is so much faster. And that's primarily because of the 9.7-day half-life. And so essentially, most of the urinary symptoms will go away within a couple of weeks, primarily because of the shorter half-life.
And that's one of the biggest concerns whenever I counsel patients about prostate cancer treatment, and they're interested in, I give them a book that talks about all treatment options, including brachytherapy, which is the implantation of radioactive seeds into the prostate. One of the concerns is the fact that they have to wear a catheter, possibly for a prolonged period of time. Often these are older men who already have existing urinary difficulties due to an enlarged prostate. And once you put in these cesium implants or iodine implants or palladium implants, they have worsening trouble urinating, having to wear a catheter for a prolonged period of time. So cesium having a shorter half-life instead of iodine, over 60 days, right? Mm-hmm. Half-life of over 60 days, that means they're suffering with a lot of potentially prolonged urinary difficulties. So this seems like an interesting alternative.
Yeah, essentially a lot of the peer-reviewed clinical data will show that patients with iodine will probably suffer anywhere from 12 to 18 months and sometimes never have their urinary symptoms resolve. The data that we've seen basically with cesium is most of the patients are back to their baseline within about 4 to 6 weeks. So it really tends to benefit the patient with a one-and-done treatment that basically takes about half hour, 45 minutes, and then they go home, and a lot of these guys will play golf the next day.
So that, we now know the advantages. What about, for the urologists, the availability of cesium implants versus iodine and palladium?
Yeah, essentially, that primarily depends on the radiation oncologist that they work with. We can work with any of the radiation oncologists that any of the urologists work with, and connect them with a isotope. It really depends on their personal preference.
And it seems like these can be shipped to the radiation oncologist center where they are providing the treatment.
Yeah, correct. We can ship these anywhere domestically in the United States. So if any radiation oncologist would like to use this particular isotope, we're more than happy to ship it anywhere they have availability to treat.
Sounds great. So for those who are interested in brachytherapy, this is something that you can inquire about with your radiation oncologist and your urologist. Let's talk about this MRI thing, this Sirius. That is more applicable to the urologist and maybe radiation oncologists, but patients may not care about. Tell us a little bit more about that.
Yeah, the Sirius C4 marker is basically something we're working with Stephen Frank and MD Anderson, and essentially what it gives the patient, or actually the physician, is the ability to look at the dosimetry postoperatively immediately after the procedure and know exactly how well they treated the prostate. So it gives them an additional tool to see how well they've done.
So how do you get these in a patient, and how does that work?
Yeah, basically the markers actually, a lot of times with the needles that are preloaded, the seeds will be in there and then there will be spacers. But instead of putting a generic non-effective spacer, which does nothing other than a 0 to create space. And so essentially what this does is it basically takes the place of that spacer, but it also gives them the benefit of being able to see the marker under MRI.
And as many people know, anytime you put anything metallic in the patient and you put them in MRI, it may affect imaging quality, but this particular marker does not do that.
Correct. Yeah, this marker is completely inert for MRI. In fact, the same thing with the titanium seeds. We have the ability to still place these seeds into a patient. They still can have an MRI. They're compatible up to a 3T MRI.
So that, just to be clear, series are these, instead of the null marker in an implant string that is loaded during brachytherapy treatment, you would put in the series marker instead of the null marker. And then this will get into the prostate, and it shows up on imaging as a way to keep track of how well the radiation worked.
Yes, exactly.
That's wonderful.
Well, thank you so much, Dr. Lynn. It was such a pleasure to meet you, and I'll look forward to working with you soon.
All right, thank you very much for the interview.